Stakeholders have emphasized the urgent need to address social inadequacies stemming from the neglect of male children. This call to action was made during an event in Osogbo to commemorate the 2024 International Men's Day. Rafiu Hamid reports.
International Men's Day, celebrated globally on the 19th of November every year, is a day dedicated to raising awareness about issues affecting men and boys, including parental alienation, abuse, homelessness, suicide, and violence. The day also celebrates the positive contributions of men to society, families, and communities. At the event organized by the Osogbo Window on America, speakers expressed concern over the disproportionate involvement of men in violence, drug addiction, and other vices, attributing it to the inadequate upbringing of male children.
We are having these intergenerational conversations on the male gender to be able to, get the issues, the challenges, and also tangible solutions that will inform future interventions and programs.
Apology to say this, if you go to all the streets in Osogbo here, there is no way you will not be seeing those guys that will raise their two hands up.
They highlight the negative influence of unchecked internet exposure and urge parents to intensify the monitoring of both male and female children. The speakers also stressed the importance of equity in ensuring the rights of men and women are balanced, promoting a more harmonious and inclusive society.
If you keep grooming good girls and you neglect the boys, you are creating an imbalance. Which boys are these girls going to get married to? We can't have a situation where you have gender equality without gender equity. That conversation must be balanced.
Equity is very, very, essential. We have to treat them equally. We have to celebrate them equally. If there is imbalances, there will be a kind of disconnect and there will be problem in the society.
Another key issue raised was the growing number of boys dropping out of school and the underperformance of those who remain, especially when compared to their female peers.
Unfortunately, according to statistics, in Osun State alone, we have 150,000 out-of-school children. And the information we are getting that 62% of that number are boys. It's a problem, it's a menace.
They advocated more platforms to celebrate and empower men, ensuring their role in society is recognized and appreciated. Rafiu Hamid, TVC News, Osogbo.
And founder Love for Health organization, Dr. Yusuf Aaron, joins me via Zoom from Lagos to discuss the International Men's Day. It's good to have you join us on the news this hour.
Thank you very much. Same here. Good to have you here.
Right. We could see that the theme for this year's International Men's Day is focusing more on the health of the men this year. What are the societal expectations that contribute to men's health issues, and how can we work to dismantle some of these expectations?
The societal expectations can be divided into the mental awareness and also the physical expectations. The mental awareness includes the child upbringing from the childhood, psychological training, mental education, formal and informal education. In terms of the physical expectations, this includes physical activities of the men, and every man should know their role in the society. In terms of the health, which we talked about, one of the leading causes of cancer deaths in men is prostate cancer. Many men are unaware of this. Sometimes they even have a misnomer or a misconception that excessive sexual intercourse with multiple women can be a way of reducing the risk of cancer, which has been debunked by a consultant urologist. Also, in terms of education, men have to know and prioritize their education. They should stop being dropped out of schools. There is a prevalence of about 12.5% of men who are into drugs in Nigeria, and a staggering 7.9% of women. So men have to focus on their health, focus on their education, focus on upbringing, and we should also not neglect that men are also abused, similarly to how women are abused. I mean, molested. Young boys are being abused in their homes. They are being sodomized. They are being raped. They are going through some kinds of problem which we are having, like being houseboys, being sold, being taken into different kind of activities, which isn't good for the society.
Right, Dr. Aaron, from what you have said, it seems there is a lot of, disinformation as to some of the risk factors leading to the health issues that we see in men. So talk to us about the actual risk factors that we see in men from the age of above 40 years. And at what age should men start getting screened to ensure that they have, good health?
One of the risk factors is poor education or poor health enlightenment or general education is a risk factor. Another one is, on contrary, multiple sexual partners can be a risk factor to men being predisposed even to sexually transmitted infection and even this prostate cancer or benign prostatic hyperplasia. Other risk factors, age, as you mentioned, when a man gets to the age of 30 or 40, it becomes a natural risk factor. Hereditary is another factor, or genetics. If there is a previous history in the family of the man with a previous condition of this kind of situation, the man most likely might develop that kind of condition when he also attains that age, above 40 years old. So he has to screen. There's something called PSA, prostatic specific antigen. The normal should be between 0 to 4 nanogram per ml. If the man is having above that, he should consult a urologist. He should see a healthcare professional. He should see a doctor. He should not just die in silence. There's lots of statistics that prove that men don't go to see a healthcare for anything. They don't go to see a specialist. They don't go
and the reason for some of this, perhaps not visiting the healthcare specialist, is traditional masculinity, which is a major concern. So very quickly, because of our time, talk to us about the effective strategies for engaging men in some of these conversations about their health and also, mental health, relationship, gender equality, and some of the major issues that affect men. And how can we sustain these conversations over time?
Yes, a good example is what we are doing right now: health education, TV presentations, health awareness. This is to let men know that they also have general issues, which could be health, which could be social, which could be mental, which could also be physical. A good example is infertility, if I should dive into that just in a second. Many men have the problem of infertility. Statistics also showed that in statistics of infertility, 40% of the causes are from men, 40% are from women, 10% might be unknown. So men and women share both factors in certain cases. So all problems shouldn't be shifted to one gender. Everybody should play a role in making sure that there is effective health treatment, effective health advocacy, and also health fighting. Thank you very much.
Right, thank you very much. This is an ongoing conversation, and like you said, everyone should play a role in ensuring the